People often say, "I have a pinched nerve in my lower back." And usually, when someone says that, they immediately add, "It must be the sciatic nerve." The sciatic nerve is probably the most famous one. Everyone thinks they know where it goes, where it comes out, and where it should hurt. But here's the truth. In reality, the sciatic nerve is almost never actually pinched or inflamed. It happens extremely rarely. Most real cases occur after surgery, especially after hip replacement. During such operations, the nerve can be slightly compressed, touched, or irritated, and that can affect its function. That situation is serious and very uncomfortable. But if there was no surgery, then with a very high probability, the sciatic nerve is not the problem. So what is really causing the pain?
Actual nerve inflammation is rare. When nerves are involved, doctors use the term radiculopathy. That means damage to a nerve root, the small branches that exit the spine between the vertebrae. These nerve roots come out between the bones of the spine, exactly where disc bulges or herniations can appear. The most commonly affected nerve root, about 90% of cases, is called S1. It sits between the fifth lumbar vertebra and the sacrum. A bit less often, the L5 and L4 roots are involved, which are slightly higher. Together, these roots account for almost all cases where nerves are truly affected. Now here's the key point. Nerves are not mainly about pain. They are about function.
Each nerve has two main roles, movement and sensation. That's why real nerve problems almost always show up as weakness, loss of control, or sensory changes, not just pain. The easiest way to check this is through the legs. To test the S1 root, try walking on your toes. If you can do that normally, S1 is most likely fine. To test the L5 root, try walking on your heels. If that also works, then it's almost guaranteed that no major nerve root is damaged. Exceptions exist, but these roots usually make themselves very obvious when something is wrong. So why does the pain feel so strong?
Many people believe that severe or sharp pain must come from a nerve. But most of the time, the pain comes from muscles. That's how the body is designed. Nerve roots are well protected. If they were easily pinched, humans would not have survived evolution. Even when a nerve root is irritated, the pain often comes from nearby muscles reacting and tightening. That's why working with muscles alone often reduces pain dramatically. The body can calm inflammation on its own over time. So what can be done for lower back pain? If the pain is acute, short-term anti-inflammatory support may help. If the pain is chronic, lasting more than 3 months, medication is usually unnecessary. Instead, muscle work is key. All you need is a small ball, a roller, or any firm object. Place it under your abdomen, lie on it, and gently apply pressure to the painful area of the lower back, center, left, or right. If this is done regularly, morning and evening, pain often starts to fade.
Chronic lower back pain is one of the most common problems worldwide. There are many details and variations, but this method is one of the simplest and most reliable. If you watched until the end, respect. And if you know someone who needs this, send it to them.